Okay, so we are going to start with a general navigation of our myAvatar screen. So I have logged into the UAT train environment, and so this is what I'm going to see as I'm logging in. This should be fairly similar to what you all see as well. It may vary a little bit different, so before we get into all of the course material and the different views, some of you may be seeing a little bit different than what I am seeing. We have our main home view here, which I'm going to go over, but we also have associated views. Our associated views are going to be secondary views with different widgets or icons on the screen that really are geared toward your specific workflow. So I am doing quite a bit of trainings this month for you all, some for the mental health side, some for SUDRS, some for intake, some for clinicians. So I do have really access to everything. So if there is any point that you are not able to see kind of what I see as well, please feel free to let me know. But just know that these permissions are based by user role. So you may not see just a little bit of what I see kind of just based on what you should have access to. So as I am logging in, the first two widgets I see here on my home view are going to be my My Clients widget and my My Forms widget. So these are going to be probably your two most commonly used widgets on your home screen. These are really what allows you to navigate and complete different forms for different clients. For the My Clients widget, we see that if I am more of a clinician type, I will have certain clients that are going to appear on my caseload. So these are going to be appearing on the top portion of my Clients widget. Based on if you are having a caseload or not, most of you in this session may not be having caseloads, so you may not be able to see that feature. But you will also have the ability to search any client in the system through this Search Clients field. So as we are navigating today, we will be admitting a client. Once you actually search a client and open a form for them, the client will appear in your recent clients. This allows you to select that client at any point and move forward, add any or open any other forms for that client as well. For the actual search, this is going to be a smart search field, so I can search a few letters of my last name. I can search my full last name. I can also search last name, first name. So let me search Cody Test, and I can see my search results just shows my one client, Cody Test. I also can search by ID number. So right next to our client with the last name, first name, we see our MRN number for our client. So we've got 222-7271. I can also search by that to get my search result here as well. I can also narrow that down or make that a little bit less specific, and let's say I just want to search test. So as we have been doing lots of different trainings the last couple days, we can see there are a lot of clients with the last name Test, but we can see when I narrow that down a little bit further, then my search results also get narrowed down further. If I double click my client's name, it does, as I mentioned, appear in my recent clients. And it is at this point where I could then open a form for my client. I can open my client's chart, etc. As you do log out, your recent clients will be removed from your My Clients widget. So those are only going to stay in until that time. We do also have an advanced option to search for different clients. So if you select this hyperlink here, it brings up a search criteria select client window. So in case you really only have a few pieces of information, you can search the different clients in the system by entering in 3 different fields. If I search my client here, we see our client there. This search option also is going to be what we will be utilizing when we are admitting our clients, as it's a good double check to search the system to make sure you're not duplicating any clients. To the right, we also have our forms and data widget. So if you have any forms specific to your role that are set up in your My Forms list, this is going to act as a favorites list. So any of the forms that you are completing really every day, that's what's useful to have in your forms list so that you can actually go and just select the different form versus having to search it every time. This is going to be like the search clients. This is going to be a smart search. So this is always helpful in case you don't know exactly what the name is called, or maybe the name of the form has 5 different words and you don't know exactly the order. You can type in some of the form name. So if I type in adult, I can see any of the forms in the system that have adult in it. Let's say I'm looking for adult and adolescent ASAM LOC screening. So that's kind of a mouthful. It's a very long form name. I don't have to type that entire form name in order to find it. I can also just search ASAM and narrow that list down a little bit further. Just like the search clients, and when you select a client or open a form for them, when you are going throughout your different forms of the day, until you log out, those will appear in your recent forms. Something else I would like to point out is that every form lies in its own menu path. So these menu paths are kind of similar to your own documents on your desktop. So you've got many different folders, you've got a file path that you have to go in to get to that certain document. You can also choose to go and find these different forms by the menu path. So I can see Avatar CWS, assessments. We have our different menus here, so I can do Avatar CWS, assessments, and I can get to my form here. CWS is going to be more of your clinical forms in the system, assessments. We also have Avatar PM. This is going to be more your billing forms, your administrative, admission, discharge forms, etc. I always like to point out these menus as well because it is always a nice feature to see as you are starting out in either the test environment or newly in your live environment. This really does list out all of the different forms that you have access to. So your menus may not look like mine because, again, I do have access to everything, but you will be able to look through and kind of see what other forms out there do you have access to that you could complete. Maybe it's a form that wasn't necessarily trained on today, but you will use on one-off scenarios. You can find forms that way if you're not exactly sure of the form name. We do have our Message Center widget here. So it does show as blank as of right now. So what page are you on the guide? I do not know the exact page number. But I should be fairly near the top after the agenda. So the first part of the guide after the agenda does go over basic navigation. So it should be going over really what all of these widgets are, kind of what we use them for. And then just another note about the guide as well is that it should go in the order of our training today. If at any point it doesn't, it should be pretty near the next section, but there should be a table of contents at the top that should allow you to get to that portion of the guide. So this message center widget here is going to be for any messages that the county wants to push out for you all to view. So this is a great widget that is appearing on your home view because as you log in every day, you may want to see a message such as, the system is going to be down for 30 minutes this evening, or we've added this new form that you all can use in your daily workflow. So this is going to be kind of similar to getting an email blast to all Avatar users, but instead of having to look at all those different areas, if the message pertains to myAvatar, it may appear just on your home screen as you log in. So I'm not sure how frequently the county will be using this. I can see it being very useful as you are going live for the first couple months, just to input any messages there that they want to send out to you guys. We also have a Did You Know widget here. So this is going to give you tidbits of information, different tips for navigating around myAvatar. These are not necessarily going to be county specific. It's going to be more on the basic avatar functionality, but this is also super helpful as you are in the training environment or in the live environment, because we have so much to go over in all of these different trainings. So this Did You Know widget may give you some different tips that maybe were not gone over in the training. There are also multiple facts in here to look at. So we have clients assigned to a practitioner's caseload will appear under the My Clients section of the client staff or widget. So that is actually something we went over, but if I select this right arrow, it says Show Next Tip. SUDRS, Executive Reporting System, is now a standard part of myAvatar. So again, just different tips. This one's going over the chart view, etc. So definitely something as you are playing around to make sure you're looking at those, reading those. Moving to our bottom right-hand side, we have our My To-Dos widget. This is another great, helpful widget that is on our home view because as you are logging in each time to myAvatar, it's always good to be referencing your to-do list and managing it accordingly. So there are different times in myAvatar or different actions in which something will send you a to-do item. So a couple examples of different to-do items that we have. If someone is sending you a document to review, maybe someone is sending you a document to actually approve or sign off on. Those are different to-do items that you'll have. You can see for this to-do list, it will be separated per each specific item, and it will have an actual action tied to it. Some other to-do items you may receive is, and that we will probably see today, some forms when you submit the form in draft status, it will send you a to-do item that just says, okay, you need to review this document and eventually finalize it. So it really is a good running checklist of all of the different items within myAvatar that you need to make sure is reviewed or done. So it does separate it by item and client. So we can see for Ashley, Deborah, we've got all of these different to-do items linked to the specific form. So for Ashley, it says, I need to approve this document. The SUDRS treatment plan was completed. Someone routed it to me. So for this specific example, if I select the form hyperlink here, it will take me to that SUDRS treatment plan to actually review firsthand there. These other ones are going to be, we've got our adult and adolescent, ASAM. If you've got any forms that are in draft status, these hyperlinks will allow you to take it to redirect you to that specific form for that client. So it's really an interactive widget as well to take you right to that specific item. We also just have items in which you need to, they may be more informational, so you can review the to-do item. We'll see more information on the to-do item. The option is going to be the form, the date sent, time sent. If you need to review more in detail, this will actually produce the output of the specific form. let's say I've reviewed this previously, I need to just get this item off my to-do list. I can select reviewed and submit. And this actually gets removed from my to-do list. You also will have filters for these items. So let's say I only want to look at the documents I need to approve or the review to-do items, etc. We have a new category here or section to where it will show any recent to-do items. So these are all from yesterday's training. And then we also have a sign tab. So this will allow you to review those documents and actually attach your electronic signature as well. For some widgets that are going to be on your different views that maybe you want to see in bigger view, you can undock certain widgets. So it is going to be on the right-hand side. It's going to look like an arrow that's kind of leaving the screen. This will actually remove the widget from your screen and you can make any bigger if you need. You can put, oops, I've lost it. You can put it on your other screen if you need. If you choose to redock it onto your home view, you can select the arrow again and it will go to your home view again. We also have a refresh button on certain widgets. So at some points in the process, it should refresh automatically, but if you ever want to make sure that you have the most up-to-date information, you can always manually refresh. And so this looks like a circle of 2 arrows. And if you click it, it should refresh your widget. We also have our My Calendar widget. So this is going to be a view-only widget. So this is going to show your day's view of all of the different appointments on your calendar. This is going to be a little bit more helpful for our clinicians. We will be reviewing a little bit later on in our afternoon session the actual scheduling calendar. And this is where you will actually have actions tied to it and you'll be able to schedule the different appointments, but this is actually just a view-only widget. On the top right-hand side of our screen, the first thing that I want to mention that I skipped over is going to be your username here. So this is if anyone is sharing workstations, maybe not now, but in a future state, it's always good to double check the username that you are logged in as yourself. We have a preferences button here. This is going to be for these are going to be settings for each specific user. So my preferences could be different than Tina's preferences. These are just specific to myself. So the first thing we have here is going to be spell check. We have standard versus Microsoft Word, different standard words that we have, different actions. We then have our default printer. So again, you may be at your homes right now with different printers, or everyone in this training may be in a separate building or area of a building, so you can select specifically to your own avatar login, what is my default printer. We will be seeing throughout our training a couple reports that will be viewed on the screen, and so this is going to be helpful for when you're just wanting to print a lot of those reports out. We have themes, which can be kind of fun. They are more geared towards different seasons of the year. So if you are a seasonal person and want to kind of change things up a bit from time to time, you have the different colors. Also, another reason for pointing this out is some colors work better for others' eyes. So this is something to play around with as you are in the UAT environment. Do maybe the browns and the creams work better for your eyes, or maybe the light blues? We have some calendar options here. These will allow you to pull in your personal calendar. So maybe you've got your Outlook calendar that you want to pull in. This will just be pulling in your personal appointments to the myAvatar calendar, it cannot work the reverse way. So due to PHI reasons, you are not able to send your clinical appointments out to your personal folder or your personal calendar. If the county chooses at any point to allow you to customize your home screen, you can do so here. So this shows you all of the widgets on the view that you are on. We can see I can make the calendar smaller, the forms and data bigger. We saw that the My To-Dos was kind of small, so I could make that bigger if I wanted to. A couple different options here. We've got our chart view, what episodes will display, all or open, and then finally just a few general preferences. So I did mention the recent forms. So if you have any forms in your favorites, you can choose that I don't want to populate that in a recent form because that's already in my forms widget. Use mouse or touch for signature pads. So we'll kind of go over that a little bit later as well. A few other buttons, and then we will move on to the actual course content for today. We have our lock option here. So this is going to be a good option for if you are in the middle of your day, let's say you have a couple forms that you are in the middle of completing, you've filled out half of your ASAM LOC screening, you don't want to lose that information and completely sign out, you have the lock option. So maybe you're leaving to go to the restroom really quick or someone calls you over into their office to do something, you can select lock here and it will just lock your screen where you are. And it allows you to enter your password, username and password to open the screen back up again, but it would take you to where you were without you signing out completely and losing any information. We've got our sign out option here, so this is going to sign you out completely of myAvatar. We have switch for anyone that may be having multiple system codes. This is going to be an option. It will keep your username and password in the respective fields, but it allows you to switch the system code. Finally, we have our help option here. So a couple different things about the help option. We've got this about button. This will show you the actual specific myAvatar build that you are on and the server information. So if for some reason the computers are off at all, this is always helpful information for IT to state, okay, myAvatar build, server information. We also have a few wiki links here for our NetSmart wiki. So let's say you are working on your appointment scheduling even after today's session and you're saying, okay, that's a lot to remember, it's a lot to learn. You can always select this avatar appointment scheduling and it will take you to that section of our wiki page, which is very similar to like a Wikipedia for additional user guides, etc. So I know that took a little bit of time, but it's always nice to get a feel for the different views that you are on and working with on a day-to-day basis. I briefly touched on this earlier, but this is our home view as we do log into myAvatar, but you also may see additional associated views. So these are going to appear as different views under your My Views, so yours will look probably different than mine. I would assume that most of you may have a workflow view. So I want to touch on this view just briefly. You will see it doesn't necessarily look like they are buttons, but if you hover over, each of these different views are going to be buttons. And what we see when we do this is that we are navigated to a second view. We're still in myAvatar, but this view may have different widgets for different parts of our workflow. So this is a specific workflow view that is very useful for our training today and that I would assume most of you may have access to later down the road. But I will be going over all of these different widgets and how they kind of differ a little bit, how you interact with them, as well as how they fit into your specific workflow. You will also see that you see the forms and data and my client widget also. So we will be going over throughout this training that there are multiple ways of doing things in myAvatar. So it's not to confuse you, it's more to just give you different options for kind of navigating around. Okay. Do we have any questions on these two views so far in the training before we actually move on to our course material? Okay, so for our first session today, we are going to be going through 4 to 5 different forms. Then we will be taking our break, and then that is when we will be moving along with our exercise for this morning. So the exercise is going to have you all duplicating a lot of what I'm doing in the demonstration. So I am going to be going through each and every form, but then you will have that hands-on time to go over anything. I will be here to help with your exercises as well, but as I mentioned, I do encourage at any point, if I go over something on any of these forms and it may be confusing, please let me know. Okay, so the first form that we are going to be launching today is going to be our initial contact log bundle. So what I'm going to do in order to launch my form, I'm going to put my cursor in my search forms field in my forms and data widget. Just to remind you, this widget is also on our home view as well. So even if you do not have access to this view, you should be able to also reference that there. And I'm going to type out initial contact log bundle. Now, the first thing that we see here on our contact log or our results when we are searching my form is that we have an option here for initial contact log, and then we have our bundle. So I want to take a minute to go over the differences of these two items and when you will use each. So the initial contact log form is going to be for any client that already exists in the myAvatar system. So this is going to be a client that has an MRN number. Maybe they've already received services in the past. The initial contact log bundle is going to be for any new client that the county has not seen previously. So what our initial contact log bundle is going to do is it will be assigning a P number, which is basically a temporary MRN number, while we are in that screening process before they actually have their appointment, before we know that they are going to actually be seeking those services and that we are going to be providing those for them. So I am going to be showing the bundle portion of our training in our training today. So we are going to be acting as if a new client is calling for a referral to SUDRS and they are requesting a screening. So the first thing we are going to do, we are going to open our initial contact log bundle. I'm going to double click on the form name. So in our process today, or our example, we do know this is a new client, but as I mentioned previously with our advanced search, we always want to make sure that we double check the system. So while they may be speaking to us saying, I've never received services from you guys before, we always want to make sure that we double check. In order to kickstart this double checking process, or this verification, you will need to complete 3 of these fields that we see here on this select client screen. So whether that's first name, last name, social, whether that's first name, last name, sex. So let me type in my last name test. I'm going to do first name Tom and sex of male. So what we see here, when I have 3 of those fields entered, my search button actually becomes enabled. So if you're ever wondering why that field or that button is grayed out or you're not able to select it, it's most likely because we either do not have 3 fields completed, or if you have the 3rd field completed, you may need to click out of that field in order to trigger that logic. So I'm going to just double check. I'm going to select search. And it looks like we actually do have some Tom tests in the system. I do not want to confuse everyone in our scenario today, so let's pick a new client. Let's choose Tommy test. So if I search, I can see no matches found. I'm going to select OK. Okay, we have a question. I had a screening yesterday. A male identified as a female. Which do I put it in as? I may need to defer to the county on that one, since on this main intake, we do only have our limited options here. There is going to be an additional field I'm going to point out on our next screen, so I'm not sure if this would be, if the sex would be unknown for right now. May need to take that as a parking lot item. But great question, as I'm sure that that can come up often. So I'm searching the system, no matches found. I'm going to select new client. The first form that we have that's going to appear is going to be our call intake form. So we have any red fields that appear on our forms are going to be required. So this means that I cannot select submit and move forward in the process until those red fields have been required. We are going to be trying to point out most of the different components of each form today, but if some forms we are just completing the required fields, it is just going to be more for demonstration purposes. We do always encourage you to look at every field in order to complete it, even if it's not required. So our contact method, this is going to be a single select option. So this has a drop down of different values and we can only select one. So let's say this was an incoming call. We also have our client name here. So this is going to pull in from the previous search results. If the caller was not themselves, we will state the caller name here. We have contact type. You can see clinic, friend, self. One tip that I would like to point out for single select dropdowns. If there are quite a bit of values in the dropdown, it will automatically sort to alphabetical order. Instead of going down, scrolling through all of our fields, if you do know the actual value that you are looking for, you can type out the first 2 letters of that dictionary value and it will drop down the list to that specific letter or area of the list. So let's say I am looking for self. I know that automatically. I can type SE and it scrolls down the list for me and I can see self. We have our call date. We have a few quick button options for all of our date fields in the system. We have our calendar view that you can select and scroll back. Let's say this was a week ago. I can select the 24th of February really quick. I can also select T for today. I can select Y for yesterday's date. This is the format. I can also type in all of the characters of, or all of the numbers of the date, but without the slashes. So let's say 03/02/2021, and if I select tab, it will enter those slashes in for me. We also have the option for T plus or T minus. So this will actually calculate for you. So let's say, okay, I know this is 14 days ago. I can say T minus 14 and tab out of the field. And we can see 2/17/21 is going to appear. So a couple different options to complete our date fields within the system. I'm just going to switch it for today's date. For times in the system, we have current as a quick button here. We also have the system accepts military time. So the military time in which you will enter would be the 4 digits and then tab out, and it will actually enter it in the format that you see here that is accepted. For these quick buttons here, I always like to say, as you are getting used to the system, these can be a good way to just enter in the format. So let's say I want to say current time here. I am in Kansas City, so I am in Central Time, so it's a couple hours later than you guys, but I see current time is 11:05. And let's say it was actually 10:05. I can go in here really quick. The format's already done for me, and I can quickly change it. So definitely, even if the day is not today or yesterday or the time is current, feel free to use those buttons just to help you as you are learning the system with the specific formats. We then have our program. We are going to say SUDRS calls, and we are going to submit our form. So we may be like saying, okay, Megan, why does this say bundle? What does that exactly mean in the system? So what a bundle is it's a combination of a few different forms. This bundle is going to be sequential. So what this means is that I only had to search and launch one form, which was our initial contact log bundle, but it launches our call intake, and then I submit, and it's going to actually launch our second form. So bundles really enhance specific workflows. So for our workflow for our initial contact, we've got our new client. We need to make sure that both of these forms are completed to track all of the information. So instead of having to go back to our main screen, search another form, launch that again, the bundle really does all of that for us, and it's saying, okay, we need to make sure you fill both of these forms out, so they are going to come right after the other. Just to reiterate, the contact log bundle is for new clients. The initial contact log is going to be for clients that already have an MRN number. So we've completed our call intake form. We can see this client banner up here at the top is going to appear throughout the day when we are in multiple different forms. This shows basic demographic information. We have not actually admitted the client yet, so we don't have much demographic information to show here. But what I do want to point out is that we do have a P number associated to our client. So this acts as their temporary ID number in the system until they are actually admitted into a pre-admit program. So our initial contact log, we want to complete additional call information. So we will do date of call today, current as the call time. We do have this section for P-caller only, so this is going to be the workflow that we have since this is a new client. It is labeled as a P-caller. If we select this drop down here, it will pull in the date that was entered on our previous form. So this is kind of linking our call intake to our contact log. Some general navigation of forms in the system. Once you open or get into a form, you will see different sections if they have them here to the left-hand side. This acts as kind of your form menu. Any subsections will appear here. You can select the different subsections or the sections itself to navigate through. Any subsections, you can minimize these arrows that may appear on some of these subsection headers or these blue lines that we may see throughout the system. And then lastly, as kind of just general navigation, most of the forms in the system allow you to zoom in and zoom out on the form. So this is going to be on the bottom left-hand side. We can see I can zoom in a little bit further. The more you do zoom in, the more scrolling it may be, but some screens can be very small, so that is a great feature that we have. And then you can also zoom out in some scenarios as well. I like to keep it in the middle at 140. You may ask on the home screen if you are able to zoom in and out. That is one of the areas that you are unable to zoom in. So when I am reviewing some of the home screens, unfortunately, it just may look a little bit small on your screen. So we have our specific caller information that we want to see. Again, our client name is going to pull forward. We have just a few required fields, but this is a scenario where we would want to complete everything that we were able to. So contact method, we'll do inbound call. Program type, let's say SUDRS. We have our specific program, so this is going to have the program code as the prefix. Okay, so our program here, this is going to have our number prefix. So this does not have the option to enter in the key options to see for alphabetical purposes, but you should be able to see pretty easily what program you are wanting to choose. We have our contact reason. So we've got client callback, crisis intervention, disaster. I'm just going to say for our example today, referrals. Priority is always good to know. So we've got normal versus urgent. Okay, so we have a question. What is it for SARC? I will defer to the county. Another item I will address, my role in the trainings is going to be more importantly for the system technical aspects to lead you through how the system works, how the forms work. Any county specific questions, I will defer to the county and the super users in the room. And as I mentioned earlier, if we do not know the answer, we are happy to take those as a follow-up. And just as Tina mentioned in the chat, what programs do you normally use? That's a great question to always ask. A lot of things will look different in the myAvatar system, but a lot of things will be the same as well. So program names, etc. So always good to just ask yourself that question. And a note, I do keep getting a pop-up for to-do items. I think some of the other users or the NetSmart individuals in the trainings are sending me documents as part of the document routing demonstrations. So if you see me click out of that pop-up, it's really just saying that I have some new items in my workflow to-do list. So I'm guessing that they are routing all of those documents for me to also be able to show that process in other trainings to sign. So the next item we have, contact is beneficiary, yes or no. We do have certain event logic built into the forms. So we see if the contact is beneficiary, we see that the beneficiary name field becomes disabled. So that's very nice. That's built into a lot of our different forms and assessments. It really guides you through the form. It cuts down a lot of time as well. So you're not having to go through every single field and asking yourself, does this apply to this client? Does it not? Some of those answers will be answered for you based on previous questions. So we do have specific contact information we do need to input. Contact's relationship to beneficiary, we will do self. For the date of birth and our social security number, we do need to make sure that this information is going to be accurate and the same as when we admit our client. We've got our social, our age, insurance if we have that. So our insurance is also going to be a smart search field, so you can search by the actual insurance ID or the name of the insurance. So I've just searched Blue Cross. We also saw that when we have a contact reason of referral and priority of normal, our contact result is going to automatically default to an open call. So this is something to note for a specific widget that we are going to view in a moment. We have our beneficiary disposition. If we know that right now, we've got date of first offered appointment, date of second offered appointment, and scheduled. We have a second section here for interpreter services. So this is another area where our logic is really coming through and built in. So we've got interpreter offered, yes or no. Interpreter response, yes or no, and then specific language. Okay, so to fill in all that information, we do need to have two screens open, meaning the ASAM. We will be going over the ASAM later on in our demonstration, but yes, if this is the point where you complete both of those at the same time, you do have the ability to open a second form for your same client and do those simultaneously. Okay, so we are going to state that this is, as we see, an open call. It is going to also be a referral. So it is at this point in our example demonstration that a SARC assessor needs to start contact with the client. So what we have incorporated into specific workflow for those SARC assessors is going to be a widget that is located on our workflow view here. So if I scroll down actually to the bottom, I can see that my client, Tommy Test, actually is pulled into our SUDRS referrals widget. So this is pulling in all of the referrals that are documented as open calls in the system on that specific form. So this really is working as an acting queue for those SARC assessors to make sure that they start that contact. So at this point, I'm a SARC assessor. I can actually select Tommy Test. And what this does is it opens our initial contact log again. and we can complete any additional information that we need to. Lots of great conversation in the chat. So we have our beneficiary disposition. We will say scheduled appointment. Let's say our first offered appointment was 2 days from now, and that is the appointment that is scheduled. We will change our contact result to completed and submit our form. We can see Tommy Test is still on our SUDRS referral widget. If I refresh my widget, Tommy Test is not there anymore. Okay. And I'm going to change the setting one moment. Okay, you should all see my screen again. Okay, so it is at this point in our process. We have scheduled our appointment for our client. This is where the appointment has been scheduled. When the client actually shows up for their appointment, we need to make sure that instead of this client having their temporary P number, that they have a permanent MR number, similar to all of these other clients that I see in my caseload. So in order to actually change this P number to an MRN number, we will actually open the form, assign permanent MR number. So I've searched my form in my search forms field of my forms and data widget. I'm going to double click. I'm going to search my client in which we want to have this form for. I'm not, maybe someone might be following along, so I see 2 clients in here. But I see in my recent clients, my client that I've been working with is P10007. So that's a good way to double check. Okay, so we have a question. How do I get rid of Lucy T on the top of the screen? When I try to open another client, she keeps popping up. I'm not sure if you have the client's chart open maybe. I do want to make sure that we get through the rest of our forms before a break. So I am happy to look at that with you, Frank, once we break and get through the other items, if that's okay with you. Okay, so we've got our assigned permanent MR number form. This will show our temporary ID. So as we've been discussing, this P number here, we have a button. This is a pretty self-explanatory form, pretty easy, which I love. It's going to say assign permanent MR number. It's going to ask us, do you want to auto assign the next ID number? We are going to say yes. We don't have a specific ID number that we want to assign them, so just the next one that is available. And our client Tommy Test now has the assigned ID 2227469. We do still need to submit our form to make this accurate. And now our client has our MRN number. We do have a comment from Tina, thank you. Please make sure that you check in Simon to ensure that your client does not have an existing number. So correct me if I'm wrong, Tina, but if that's the case, then you would select no there and actually enter in the number. Okay, perfect. So what we just saw there is you have auto assign next ID number options yes or no. So if you've checked in Simon and they do not have an existing number, that is when you would select yes, that I do want to auto assign. If no, then you would select no and you'd be able to enter in that Simon number. And I'm just going to take a note of that really quick. Okay, perfect. So a few more items I want to share with the class in case they are not able to see the chat. The reason for checking Simon is because some clients may not have been pulled over to AVATAR. So we need to make sure that we are just assigning that one MR number versus multiple, and so that there are not any duplicate clients. Okay. The next part of our session is going to be actually admitting our client into our overarching SUD financial episode. This is going to be the episode in which we will link our financial eligibility to. So I'm going to open our admission outpatient form. One moment. Okay, so actually what I'm going to do is I'm also going to show you an additional way to launch forms. So it's going to be the same method for launching the form, but instead of having to search our client every time in the select client window, I'm going to click my client's name in our recent clients, and then I'm going to open my form. I put an extra space here. Okay, so I would just recommend maybe for the rest of our session today that we just focus on my demonstration. I want to make sure everyone is able to see what I'm doing instead of trying to follow along on their screen or having any issues with how their screen is working, because I do want to make sure that we don't get left behind. We will have time to troubleshoot any issues that we are having on anyone's own screen when we do take our break or start our exercise. Okay, so we are opening our admission outpatient form. We do need to re-enter our social security number. So this needs to be the same number that we were entering on our initial contact log bundle. We have our date of birth. I am going to get a pop-up. It says the Social Security number has already been filed for the following patients. This is just because we are in a training environment and we're using just generic ones as a Social Security number. So you should really never see this pop up in your live environment. If you do, this is a good double check to make sure that you've entered the right social security number, that you maybe didn't incorrectly add in a certain number. We have our date of birth. We have our pre-admission date and time. I'm going to say T for today and current. We have our program field again. We have our type of admission, SUD admission. When we are completing different forms in the system, we always try to start on the top left-hand side, work our way down. If there is another column, we'll go to the right-hand side, work our way down until we see a new section. We do have our admitting practitioner field, so this is going to be a staff lookup. So I'm going to look up myself. If you all in your exercise do not see your name as a staff member, feel free to use my name here to get you through the exercise. We have our CSI required fields. Client's living arrangement. Any disabilities that we may need to record, as well as a few questions relating to consent, acknowledgement, and the beneficiary handbook. So received copy of beneficiary handbook, yes or no. If we had selected no, we do have an admission note here. Completion of acknowledgement of NOPP form. Completion of consent for outpatient treatment form. Advanced directive, if we select yes, it will be a note that is required. If no, we have that as disabled. Correct me if I'm wrong, Tina, but I believe this account number would be the Simon number. So this is the area in which you would enter that in. We also have data element help message buttons here. And these are going to be seen many times throughout different forms in the system. These give you helpful information to complete a field or certain direction on kind of what the county is looking for. And actually, I asked a question that I already knew because this light bulb actually tells us this field references the account number from Simon. So just as you may be confused on the account number, you can always look at that light bulb to make sure that light bulb isn't going to help you complete that number. We then have our demographics section here. So this is also an area where the more information, the better. We do have our required fields, but we always want to make sure that right off the bat, we capture any demographics that we have for our client, as some of our demographics will push forward to other areas of the system. So we'll see this as an example when we complete our financial eligibility for our client. But this can help your clinicians to have the most accurate data for our client immediately here. We also will see some of this demographic data will appear in our client banner as we are completing different forms. We do have our preferred name, so we have a note here that says searchable. So it looks like we are able to search our preferred name. So maybe Tommy goes by Tom or a completely separate name. Instead of searching Tommy, which is our legal given name, you could search by that preferred name. We have our client's address, street. For those that are not as reliant on their mouse, and maybe they like to navigate through their computer with their keyboard. We also have tabbing order that should be set up for the majority of our forms, so you can tab from the next field to the next field and use your down arrows or left and right, as well as your space bar to make selections. So whatever your personal preference is. If you do complete a single select dictionary or multi-select field and you incorrectly add or incorrectly select the wrong item, you can always select the field and select FN and then F5, and it will remove that value. So just some tips to help you with your navigation as you are learning in myAvatar. We do have our zip code, so I will do 92346, and I will select my tab key. This will pre-populate in my city, state, and county, which is really nice and helpful. We've got our client's home phone number. We do have, are you heterosexual, lesbian, gay, bisexual, transgender, or do you question your sexual orientation? So while I still do not know the answer for whoever asked earlier, what you would have as the stated as the sex, but this is going to be an additional question that can help with how that client sees themselves. So we've got gay, heterosexual, bisexual, transgender. Going up to the top right-hand side, we have primary language. I can quickly go down to English if that's the answer by typing EN and then selecting enter. Our ethnic origin, education, employment status, we also have a section for alias, smoking status, etc. Okay, so again, this is our overarching episode for our SUD Financial. I'm going to select Submit. Now we are going to open our pre-admit form to complete to enroll a client into our pre-admit program. So as our client is showing up for their screening, let's say at this point we have not determined their level of care, so we want to make sure that this client is in just a pre-admit episode. So I'm going to search my client's name, Tommy. Excuse me, not search. I will select my client's name and then open the form. Pre-admit. Okay, so we do have an episode pre-display here. Since this is going to be a new episode, I'm going to select Add. Any demographic information that we have is going to pre-populate in. So we've got our sex, date of birth, age. We have our pre-admission date, pre-admission time. Our program is going to be our pre-admit SUDRS. It is going to say that we are active in other episodes, so I am going to select OK. That is what we would like at this point. If you do have your client, 99% of the time will be already admitted into that SUD financial episode. So most of the time you will be just focusing on the pre-admit form, but we wanted to show that admission form also in our process. Our type of admission is going to be SUD admission. And our admitting practitioner, I'm going to select or search myself. Our demographics in this form is going to also pull in the required fields that we had entered previously in our admission form. We have any clinical summary that we need, so current psychiatric medications, other medications, drugs of choice, and any pre-admission comments to mark down. And we will submit our pre-admit. And our pre-admission episode is now open. All right, so we have 2 forms left before our break, but I do want to pause to see if anyone has any questions before we move forward. And I do want to make a quick correction. The admission outpatient episode that I had opened, I think that I had selected Cedar House, but I had meant to select our SUD financial episode. So when we complete our exercise, that is going to be what you will want to select for that portion of the exercise. There are so many different areas where I've been selecting Cedar House that I guess I got a little click happy. Okay, so now we are going to be completing our financial eligibility episode, or our financial eligibility form. As a reminder, I'm going to select my client Tommy test and then open my financial eligibility. This is a form that is helpful to know how it works because it is very different from the way the other forms work in the system. So I will spend a longer portion of time going through this form, and I'm also happy to re-demonstrate it at any point this morning in our session, just because it can be a little tricky. But I have been told in the other sessions that your financial investigation or another program that is doing all of this financial information will be helping out with these as well. So this is our episode selection screen. So I'm going to select which episode I want to link this financial eligibility to. So normally when we enter our forms, I've been going over kind of navigation. How do we go through each form? Usually I will say that you will start with the first section, go to the next section, etc. That's your normal way of moving through the different forms. This form is a bit of an exception to that. You will select your guarantor selection section first. So I'm going to repeat that one more time. Upon opening the form, you will immediately be looking at the financial eligibility section, but you will first go to the guarantor selection. What we see here at the top portion of this section, this is going to be a MIT table. So we will see this multiple times throughout our day today. So hopefully that will help us practice with how this section will work. This allows us to enter in multiple records or lines of the same information using the same section. Before you actually are able to start entering in the guarantors for this specific section, you will need to select Add New Item. So it looks like all of these fields are normal. If I try typing in the guarantor number, it's going to populate an error. So it's going to say guarantor information item must be selected prior to accessing this field. So again, you do need to select Add New Item. This is really what triggers the ability to enter in this data here below. So now I am able to enter my guarantor number. For today's example, I'm going to select Medi-Cal. So if I type in MEDI, just for the first part of our Medi-Cal, I can see we've got Medi-Cal MH, SUD, Medical Mutual of Ohio, Medicare. So another example of where you can search just part of our guarantor, or you can search the ID as well. A few fields will be populated in based on the guarantor that we select, and this is based on back-end setup in the system. So we have our guarantor plan is going to populate, as well as our effective date of contract. So we have customized guarantor plan, yes or no. If we did need to customize our plan, we have a few fields down here below that become enabled, and then we also have a second section here in order to customize the plan further. For today's demonstration, I'm just going to select that we do not need to customize. We also have our eligibility verified. Next, we have our subscriber information field. We will see firsthand that we have automatically defaulted. Our client's relationship to subscriber is going to default to self. So when our client's relationship to subscriber is self, we will see that our subscriber name, address, zip code, phone, social, this information is all going to populate in based on the information that was entered in our demographics area. So this is a perfect example where if it's entered in one spot, it may prevent future areas of having to enter in that information. This also helps keep all of the information that's very important, such as your social, address, the same all throughout myAvatar. We have our coverage effective date, so let me do beginning of the year. I'll do 01/01/2021. You will need to be careful, as we do see that some fields within this form that are required are populating in. It can be easy to miss a few required fields. So we've got subscriber assignment of benefits, yes, and release of info, yes. If we needed to include any employer information, we have this section here, as well as benefits and eligibility. We have our covered days and covered dollars defaulted in as well. So the next portion or workflow of our financial eligibility form is to, if we had multiple guarantors, we would add new item here. What we see in this section, we have all of the information we added for our Medi-Cal guarantor is going to populate into our table here. And when we do select add new item, we will see our fields here below all become cleared out. So this allows us again to use the same fields, same section to complete multiple entries. So I'm going to say Blue Cross, Blue Shield, as we mentioned. going to complete my fields again. We see that for Blue Cross Blue Shield, our client's relationship to subscriber does not auto-populate. So you would need to state this here. It looks like for Medi-Cal it does. I'm going to select self again. So I've entered in 2 of my guarantors. Our next step in the process is going to be going back to our initial first section. And what we see here is we have our guarantor number 1 and 2 field that is going to be required now. What this does is this will actually pull in the guarantors that we entered into this second section here. So we've got our guarantor number 1 and we have our 2 options here. It's going to pull in. This is going to state the order of the guarantors in which we want to be billed. Since we entered one of our guarantors in guarantor number 1, we just have our other option for number 2. And we are able to submit our form. Okay, so we have one more form that we are going to be completing, and then hopefully we'll have about 5 minutes left for questions, and then we will be taking our break, and then we will be getting some hands-on experience through our exercises. So I'm going to switch clients for this portion of our demonstration. The next form we are going to be completing is going to be our real-time request. Real-time inquiry 270 request. So this is going to be used to submit a single 270 eligibility request. We will enter our client ID. So this is a particular form where you do need to enter the client ID on the actual form itself. We'll select our specific episode, SUD Financial. We have our guarantor. Then we have 2 different types of requests. We've got our generic, meaning we don't need to specify the specific service code, or we have specific. I will do generic for today. And then we have a date range. And then we have process request. We see that the compile is complete. And I'm going to switch how I'm sharing really quick because we do have a report that is going to generate. And I don't believe you can see that really quick. So one moment. So automatically we have our 271 errors report that's going to generate, in which we can see response data for this specific request. We can see for our specific guarantor. We've got generic financial eligibility. We've got, we can see that it cannot process. We've got a rejection code, follow-up action, please correct and resubmit. This does get opened in a new window we see here. So again, if you need to put this on a different screen, if you have the option to view it. We also can go back to see any errors associated with file load, known clients. and then you'll post inquiry if that applies to this specific scenario. This is going to be different than your submit, but instead of submitting the actual form, you would do post inquiry. Okay, so before we complete our adult and adolescent ASAM LOC screening, for the next portion of the session and this afternoon, I do want to highlight some more of these widgets on our specific workflow view that you are seeing on the screen here. So what we have been focusing on thus far is selecting our client and then opening our form. We do see that we have a couple widgets over here. They are blank as of right now, but these are single and multi-form console widgets. These are widgets in the system that do have functionality tied to them that allow you to navigate and view documents that are set up accordingly for the specific widget. You will also notice that these are client-specific widgets, meaning they are going to be blank if these forms have not been completed for the selected client or if no client is selected. So to demonstrate that a little bit, I will select my client from previous trainings. And I will make sure I have the right episode selected. And I can see that for Cody test, now these widgets are populating with information. So the first thing that you can do within these widgets, if the client does have any records that have been completed, this first widget here is going to be specifically for the SUDRS SARC database. So only records of the SUDRS SARC database will appear in this widget. If I select View here, I will actually see that I can view this specific record in the console widget viewer. So instead of going to the My Forms widget, having to search the form again, open the specific record, these widgets really allow you to interact and view all of these documents all at one time. I can also open a new record, meaning I want to complete another SUDRS SARC database. I can do so here, and I can also open my record as well. So let's say instead of viewing in this console widget viewer, maybe I want to actually open the record to see the actual form content as it was filled out. So I can see that I can open it here. I am going to exit out of the form. This is going to be a form that we review in our session later. For our SUDRS Forms widget here below, we have the same functionality that we do in this first widget, but we see we can launch multiple forms, so either the care coordination screening, adult and adolescent ASAM LOC screening, and the residential treatment pre-authorization. So instead of just one form like we see in this widget, we have multiple forms in which we can view the specific documents, open them, or we can launch new records. So this is where I will be kind of navigating from throughout the rest of our training today. So I'm going to be showing how do we launch the forms, as well as once we are complete and have finished the forms, how do we review them afterwards or at a later date. So I'm going to select my client Tommy Test. And for the next form, I'm going to select New Record and Adult and Adolescent ASAM LOC Screening. You do want to make sure that your right episode is selected here because these widgets are also episodic. And this will launch my form. So this is something definitely to practice a little bit, but as you get used to it, it can be a different and faster way to open and view the documents. Okay, so as we open our adult and adolescent ASAM LOC screening, I'm sure you guys are pretty familiar with this form. I won't be necessarily highlighting all of the specific information, but I will be definitely going through each section to kind of show how it looks and appears in myAvatar. First, we have our date of assessment field. So this is going to populate in today's date. Okay, so we do have a question, and I will address this before I get into the form. What if our screen doesn't have all the widgets? Yours does. I didn't see anything specific to SUDRS on my Avatar UAT sign-in. So I do have access to everything for my training. The views that are assigned to the home view are going to be based on role. So I would assume if you are using all of these forms that we are going through in our session today that you would have an assignment to this specific role. But if not, then you may not have that assigned. The other thing that you'll want to check is upon logging in, you will always see your home view, but I am actually selecting my workflow view. So if you don't have that workflow view, I definitely would take note of that, that you think that you may need access to that, but it is all based on access. Awesome, thank you. Also, Tina. So if I go back to my home screen, this is also a good training point. I did have a form that was open for my client, Tommy. How this will appear in the home view is that I can navigate anywhere else on my home view, but I can also see that my client, Tommy T, has a form open for them. So I can quickly toggle back and forth if I need so within my client's form and to my home screen. So this form does have draft final on it. So if at any point you need to submit the form and navigate elsewhere or log out for the day, you would be able to come back in and make any edits as you see need. When you are done making all edits and you've completed all of the required fields, everything else, you will come back and finalize this document. So we have our type of assessment. So this is going to be adult or adolescent. So I will say adult 21 plus. My service type, we've got initial or an update. I will do initial. We have our screener. This is going to auto-populate if your user is associated a staff member. So mine is, so this will auto-populate. When you complete this form for yourself, if you are not associated to a staff member, it may be blank, but just as we did in the previous exercise, feel free to search my name to complete that required field. Then we have our provider as well as our location. We have our additional funding source. We then navigate to our second section. So what we see here is that we will have a different section for each dimension that we have. So this first section or first dimension is going to be split up into two sections. And this is going to be because we have a dimension here, or a MIT table. So this is what we also viewed in the financial eligibility form. So who remembers, so same functionality as financial eligibility, what do we have to select possibly on this screen before we can actually complete these fields? If anyone remembers this table here that we saw in financial eligibility. Wonderful, yes. So As we had a class member say, you will need to select Add New Item. And it will notify you with an error if you do not do so. So if I try to select my alcohol, it's going to say an item must be selected prior. So we have our fields that are now able to be selected. We have our line here that's going to be appearing as green. We are going to be selecting or entering in our first substance that we want to record. I'm going to select alcohol. As we do complete all of these fields, we will see that they will appear in our table up above. So we've selected alcohol. We can see our first entry is going to be alcohol. We have recent use, past 6 months, and lifetime. Our route, frequency, age of first use. We have our quantity used, duration at this quantity, and date of last use. So if I want to record multiple substances, let's say I've got 1, let's say I've got 3, let's say I've got 4, you can do so accordingly right in this same section. You would just add new item for your second substance. Just as financial eligibility did, we see all of our fields are cleared out and we are able to record our next entry. If you tend to get a little click happy like I do sometimes and accidentally press add new item too many times, it will, if you do have an entry or a line that's open here that's not completed, it will record that as required fields that are missing. But you do always have the option to delete the selected item to remove that line in which you do not want to actually move forward with. Something we'll also note on this form and many other forms is we do have autosave turned on. So I'm not sure of the actual quantity of how often it is saving. I know that the default is usually 2 minutes, but this will auto-save your assessments even if you do not submit them in draft status. So if something happens with your computer or if you accidentally exit out of your form, you would be able to retrieve those previous records that were auto-saved. It will show you a timestamp here of the last time it was auto-saved. So we've entered in both of our substances. Now we have certain questions relating to the dimension that we need to answer for our dimension 1. So we do have a lot of event logic on this form for each section. So the event logic in this form really should help guide you through all of the questions. Most where you will see this is going to be if it's looking for explaining different items, you will have that required. So if opiate use is indicated as the client, have you been prescribed Narcan in the last 30 days? We can see if yes, briefly explain, or no. Okay, so we have you been hospitalized due to your alcohol or drug? We do see our light bulbs again like we saw in one of our other forms. So we have, in order to view the light bulb information, you have please explain in the narrative. You can hover over the light bulb or you can select the light bulb to see that verbiage. I will go through each of these questions and just say yes or no accordingly. After each questions for each section, you will have a severity rating to mark and a narrative justification for rating. Okay, we have our second question. Dimension 2 for biomedical conditions and complications. So do you have any current physical health problems? Prescribed or taking any medications for a medical issue? If female, are you pregnant? Do you have a physical impairment that substantially limits a major activity? We've got a light bulb on the scrolling free text, so this just says, indicate if accommodations are needed. We have our severity rating again, and our justification. We have dimension 3, emotional, behavioral, or cognitive conditions and complications. So if we say, do you ever hear or see things that others do not? Yes. If yes, do they occur mostly when using or withdrawing from alcohol? Have you been hospitalized for any mental health conditions? Are you currently taking any medications for mental health conditions? Have you attempted suicide? Do you have thoughts of suicide? If yes, do you have a plan? And if yes, you do need to consult with LPHA. Do you currently have thoughts of harming yourself? Do you have a history of memory loss and/or head trauma? We also have on our dimension 3 our type of clearance. And again, our severity rating. How often have you missed important social, occupational, educational, or recreational activities? Just going through some of the other questions we have here. Explaining where I need to. We just have a few dimensions here. We have any important stressors or triggers in your life. This is going to be a multiple select, so you can choose multiple items. We have our dimension 6. Are you currently involved with any of the following? Finally, we have our level of care. If at this point we don't have any more questions to complete, we will go back to our first section, select final. It will say selecting final prevents future edits, and you can submit your form. This will then allow you to enter in your password to attach your electronic signature to, and it gives you the option to route it to any individuals as an approver. So if I want to add Megan Wirtz as an approver, I will enter her name, select add, and submit. Do we have any questions? And just as an FYI to everyone, if you do receive that pop-up about engagement, it does let us know that your engagement is low, meaning you may be on other applications when you should be watching the demonstrations or participating accordingly. So this is not something that I mentioned beforehand, but good to know now that we can see those engagement levels. We can see if it's high engagement, low engagement. So definitely something to be noting. I have asked the class a few questions just broadly, but I may be starting to call certain individuals out for participation instead now. We do have a question for County. Why does the screening tool continue to leave out more in-depth questions regarding trauma, sexual, physical abuse? So great question, Eric. If we cannot answer that, we will make sure to add that into our county parking lot. So for the initial contact log, if I can spell initial right. Oops, I'm in the My Clients widget. That would be why. So for the documented attempts, that is going to be referring to these fields here. So if you attempted to contact them and you offered a first appointment, then offered a second appointment and a third appointment, you can reopen this form up for the same client and add that information in, if that makes a little bit more sense. I may have to defer to the county on that one. You do technically have the ability to open the initial one, but I'm not sure if they want you to add new logs for each one or edit the previous one. So I will have to defer that question. If we I'm not 100% certain if you are editing the initial or adding new records. So if we do not have the answer to that, we will want to add that as a parking lot item, just because I don't want to speak incorrectly. And then we also had a question from someone. They said that they did the ASAM, but they wanted to make sure they did it correctly. So what's your client's ID or name? Sally May for the ASAM. So this is a good training point as well. I can search my client. I can search Liana's client, Sally May. If I search this client in the My Clients widget, I can actually see right here, because this is one of the forms that we have in our widgets that we've incorporated here, I can see that yes, you have this form here, and it is in draft status, but that's okay for today. And I can view everything that you entered in this assessment here. If the form is not a part of one of these widgets, another way to view if there has been one that's entered, you can always try to open the form again, and it will show any existing records. So I have Sally May's name. I can search my adult and adolescent ASAM LOC screening. I have previously filled this out, so it is a recent form. I can see for which episode. Let's see if it's the second one. And I can see this record here. So this shows me that you do have a record on file that was done on the 3rd, which is today. So wonderful job. I will share my screen again. So as we were discussing, we do have, as we submit our residential pre-authorization form, the report version is going to automatically generate onto our screen. So similar to when we were doing the real-time eligibility request, the report will be available in a new window. So I can see I've got my report here, and then I've also got Avatar up in the background. I also have the ability to zoom in on my report to see it a little bit better and closer up. We can see that this report is pulling in the data from the form that we had just completed, but it is going to be in the format that I'm sure you all are aware of and used to for today's purposes. We can see that our priority population has been selected. Our level of care that's been pre-authorized is selected as well. We have a draft watermark here that just says, okay, this form is in draft status. We can see the document has been digitally signed by myself as the user. We also see that we have some additional data that is pulling in from elsewhere in the Avatar system. So our client's name, our date of birth, the chart number. and our program. So this isn't information necessarily that we had entered into our form, but this is pulling from the myAvatar system. So very cool that this automatically generates, again, a really nice feature for if you are needing to print this out. It's really nice that you don't have to automatically go and search another form or report and launch it, that it will do that automatically. Okay, so we do have my test client, Tommy Test, in which I admitted into a pre-admit episode earlier today, this morning. I'm going to now open my pre-admit discharge form. I'm going to make sure I select my pre-admit episode. We have our episode number is going to automatically populate in. We have our date of discharge as well as our time. What you may have noticed with the date of discharge is that when we entered that, it is going to automatically enter in or display the day of the week that it is. So it is Wednesday today. It's also going to calculate the length of stay. So this isn't a very realistic example since we are wanting to highlight both forms today. So our admission and discharge is today. So it's only going to state one. But normally that would calculate the length in between. We have our type of discharge. We have our prefix items for mental health programs and our SUD programs. So in order to get to those SUD programs, you can always type in SU. To scroll down a little bit, we have completed treatment, death, incarceration. We have a few that are left before completion. We've got satisfactory, unsatisfactory. So let's say SUD completed treatment, no referral. We are going to enter my name or the staff member for the practitioner staff lookup field. If client was accompanied by anyone, if we have any discharge presenting problems, primary, secondary, tertiary. We have current resident code. Homeless indicator. And we have any discharge remarks or comments. We also, at this point of the process, we will want to make sure that we are going to our demographics section. We will have all of the demographics pull in. So we have our client address, zip code, city. If at any point any of these are different, we will want to make sure that we update it here. And we can submit our form. And that is going to be our pre-admission discharge. So we do have a comment message says not a pre-admission episode. So you will have to have a pre-admit episode open in order to complete a discharge from a pre-admit. A pre-admission episode is going to be for our episodes in which, yes, so they are different. The pre-admission episode is going to be when you are scheduling the client's appointments. It may be your screening forms that are linked under that episode. They're not exactly admitted into the system yet. Okay, so the next form that we are going to complete is going to be our Notice of Adverse Benefit Determination. Oops, that is our clients widget. Again, when we are searching our forms, we can just search part of our form name and it should populate the actual name. We are going to want to select our episode. And this is going to be our Notice of Adverse Benefit Determination form. So our date and treating provider is going to populate in. Just want to reiterate that if you are not associated to a staff member, this treating provider field may be blank. We have our program lookup. This is going to be a little bit different of a field. So instead of the drop-down program lookup fields that we've seen previously, this is going to be a search field. And it also is searching by the program code. So if I just type in H here, I can see my Cedar House. I can state service requested. My NOABD type. What we see when we select our specific NOABD type is that the applicable type subsection is going to be required for our selection here. So it's kind of hard to see on this first field here, but we do have authorization delay notice selected. So we have our checkbox here that we need to make sure that we check, as well as enter in our date requested. If we had selected any of our other items, that respective subsection would become required. I can also minimize our subsections. So we've got our denial notice, our financial liability notice, grievance and appeal timely resolution notice, modification, payment denial, and termination notice, as well as our timely access notice. We also have our NOABD general statement. So you may ask for free copies of all information used to make this decision. This includes a copy of the guideline, protocol, or criteria. To ask for this, please call clinic at clinic phone number or the clinic name and phone number here. Finally, we have our authorized signature field. In order to capture the signature, you will select the Get Signature button. I am going to get a notice or an alert on my screen that says I do not have a signature pad, so our Topaz signature pad is not installed. So I can say, okay, if you guys did have the signature pad, you would see that this would appear on your computer and that the client would be able to, the client or the authorized signature in which you're wanting to capture, it will be captured on that signature pad and it will go into the space here. You can also do it with your mouse as well. And press OK, and our signature will then be added into our authorized signature field. This is going to be similar to this should be similar to what we saw earlier. So when I submit my form, in about just a second or so, I will see that a report output version will be produced or available to see on our screen automatically. So the verbiage or labels that we saw on the screen previously are also added, but we have our client information, treating provider name. We have our substance use disorder and recoveries field here for our clinic name. We can see for this report, we do have 2 pages, so I can go to my second page in which we will see the authorized printed name. So this is going to be my name in the system as well as my signature. And we see enclosed are going to be your rights, which is the NOABD language assistance taglines and beneficiary non-discrimination notice. We can make this bigger also. Whoa, not that big. We can print this out if we need. We can save it. Do we have any questions on those 2 forms? Wanted to reiterate, for the pre-admit discharge, you do have to have an open pre-admit episode. Okay, so when we are looking at our home view, we did mention we saw our My Calendar widget. So this is going to be a view-only widget that we have. Can everyone hear me okay? I heard some weird noises of my voice. Want to make sure there's no, okay. I'm not sure what happened there. I'm not sure if you guys could hear it or if it was just my microphone, but just wanted to double check. So this is going to be probably on most of the clinicians' home screens. It is really just to view any of the different appointments that that clinician or that staff member has for the day. In order to actually schedule appointments, you will open the form scheduling calendar. Okay, so what we are seeing here on our calendar, I want to start with a brief overview before we get into the actual demonstration of adding the different appointments. So the appointment scheduling is going to be a complete module within myAvatar. So what this means is this module links traditional aspects of appointment management. So we have date, time, reoccurrence, practitioner, location that we will state. We also have the capability within myAvatar to link the appointment and the appointment details to progress notes within myAvatar on the clinical side. So this is going to be one of the areas where the entire myAvatar application works together. So our PM or kind of billing side is going to work with our clinical side. And what this does is it really allows us to bill for all of those services that we are having on our calendar on a daily basis, making sure that we can account for everything and that we're getting reimbursed for all of the services. So the billing functionality is going to be tied in. The appointments can be posted, and this will create billable services. Payments can be documented at appointment check-in, and receipts also issued. So there is a lot that we will be going over with our scheduling calendar. It's a really cool module within myAvatar, and I know we got a lot of excitement in the last couple sessions due to this being, I think, an improvement in your workflow or processes as you have today. So lots of cool functionality that we will be going over. As far as the different type of appointments that can be scheduled, we do have individual client appointments. So these are going to be stated by the different service code setups in the back end of myAvatar. So you'll be using all of those individual service codes, maybe psychotherapy, individual assessment. It will require a client and a clinician in order to schedule the individual appointment. We also have group appointments, so this is going to be identified by those group-specific codes, and this will require a group ID, group members, and a clinician. We also have indirect or staff activity appointments that we will be scheduling, so these are going to be more maybe services provided to community members or other staff activities such as training that we can also track on our calendar as well. And this will not be linked to a specific client or group. It will just be an ability to, or a way to block off that time on your calendar to prevent any client appointments from being scheduled, as well as a good way to see an overall day of activities. So all appointments do require a site, a service code, start and end time, duration, program, and practitioner, and then we also have the ability to add in co-practitioners. So we will go over, it sounds like it's a lot of information to input, but it actually is fairly simple in order to actually create these appointments. A little bit about the actual screen that we are seeing here and some navigation to help before we do add our appointments. Each calendar will have certain appointment sites. So sites within myAvatar, they're basically different locations, physical locations of different programs. So if a program does have multiple locations, you will have multiple sites for those programs. You may have a combination as well if you have certain specialties of sites as well. We also in the back end set up certain staff members to these specific sites according to their day of the week and hours of availability. So not only do we set up the site hours, so let's say this site is only open from Monday through Friday, 7 a.m. to 7 p.m. Maybe the other site is open 7 days a week, 24 hours. You can set all of that up specific to each site. And then more granular, you can set up those hours for the practitioners. So you may have certain practitioners that share time between locations or different sites. So you can say, okay, maybe Monday, Wednesday, Friday, I'm at this clinic, and then Tuesday, Thursday, I'm at the other clinic. Or maybe I'm a clinician who only works 12 to 5 every day. You can state that availability there so that everything is set up and that you have all of the open times in order to schedule the appointments. So the appointment sites are going to be located here as our filter, so you will only be able to see one at one time. So we can see my certain practitioner is actually associated to 3 different sites. For those of you on our training today that may be scheduling for multiple sites, you would have that ability to do so here, in which you would then just switch that specific site. You would also be able to see all of the staff members that are available or have hours at that specific site. So the clinicians, I have more of a clinician view as I'm seeing my calendar now. The clinicians are only able to see their own calendar. So we can see I've got my sites that I'm associated to, but I can see my staff members. It only lists me. So just to reiterate, your view may look a little bit different when you actually are in your UAT environment or in the live environment. You may see 10, 15, 20 different staff members in which you can check off their names in order to view their calendar. If you want to view one clinician's calendar at a time, you can just check their name. You can also check multiple clinicians to kind of compare everyone's schedule that way as well. Okay, so downwards a little bit on our left-hand side, we also can change the way we are viewing our scheduling calendar. So if you want to just schedule or view the calendar by the day view, you can do so here. You can search the week view. So this is going to show all of those days in which I have hours for that specific site. And then you also have the opportunity to look at the month view. But as you'll see, when you look in the month view, the appointments can be very small. So the different view kind of will give you either more access to information or kind of more limited viewing ability. You also can see if you can use these left and right arrows. So if I'm selected on the week view, I can do the left arrow to go back each week or in future weeks. You can also do that for days and months as well. You also will have just your overall calendar view here of the month. So in case you needed to select a specific day or change the month down here, you can do so there as well. We also, as we are seeing the appointments on our calendar here, and as we actually schedule our different appointments, you will see a color coding or a key down here at the bottom. So you can see anything that is shown as gray will be non-available or the clinician is out. We have any personal or staff appointments, so that last appointment type that I had gone over for staff activities, those will appear in green. Any individual client appointments will appear in a yellow or orange color, and group appointments will appear in blue or kind of a purplish color. If you would choose to link your Microsoft Outlook or Exchange email as well, those will appear, and it looks like it's going to be a lighter gray color to view those appointments there. So with all of these different colors, you can easily kind of go throughout your day and see as a clinician what you have scheduled, or if you're an office assistant or doing the scheduling, you will be able to see the different categories on the clinicians' calendars. Okay, so now I'm going to go through and add in an individual appointment, a group appointment, and our staff activity appointment. Before I do that as well, we will see this area here to the bottom right. This will dictate the increments of time that you see on the calendar. So the largest time that you have is going to be 30 minutes, but you can select the plus button here, and I can see now my days have the separations or the chunks of time for 20 minutes, 15 minutes, 10 minutes. So that's also kind of personal preference. You will see that when we actually start adding in our appointments, kind of where that makes a little bit more sense. To actually add in an appointment, you will right-click on an open white space within the clinician's calendar. So let's say I want a 9 o'clock appointment on Wednesday today. So I can actually right-click on where I see the 9 o'clock line, and I will see Add Appointment. What this will do is it will produce a new window or open a new window. And this is going to be for our appointment details. Right off the bat, what we see is any information that we were able to gather from our right-click selection previously is going to pull forward. So what I mean by that is I do have Megan's calendar selected. So her name is going to automatically populate in my practitioner field. I am also selecting her name in the Mariposa Community Counseling site. So our site is going to automatically be populated. My date, I selected 9 o'clock on the 3rd. So my appointment date is going to populate in. My appointment start time, 9 to 9:30. And my duration is going to automatically populate in based on the duration on the previous selection here. So the bottom right-hand side. Our appointment status is automatically going to default to scheduled. If at any point, we will show this later, but you need to cancel or mark this appointment as canceled or no-show, you'll go in and edit the details and change that status there. Because all of this information is populating in, it does not mean at this point you cannot change it. So let's say this actually is a 60-minute appointment. I can highlight my duration of 30 minutes and change it to 60 and select my tab key. And what this will do is it will actually change my start and end. It will change my end time. We do have an area for any specific appointment notes that you may need to capture. One thing I will point out is that the appointment notes can only be viewed by the clinician when they actually manually view the details of the appointment. So any notes will not appear on the actual calendar itself. So that may be a county decision whether they are requiring any notes or whether the clinician always has to verify and view those details to make sure. The next section we have here is going to be our service detail section. So we have the specific program. I'm going to choose my 36991M. And I'm going to enter my specific service code. So I'm going to search the actual code. I could also look at the description as well and search that. What we notice that when I actually input this service code, the system is recognizing that this is an individual code. So this is set up in the back end when all of the service codes were set up to really help guide you through the appointment scheduling process. So you're not going to have to look at this service code and be like, okay, is this a group code? Should I be entering a group? Because this is not a group code, and so our group number field is going to become disabled. This is an individual service code, so this does mean that we do need to complete our client portion. So we do need to actually select our client. I'm going to select another client I've been using for scheduling. We can see now we want to select our episode. We can add any co-practitioners in here. These are going to be both staff lookup fields. We also have this area here for reoccurring appointments. So if anyone on our training today is familiar with setting up meetings within Outlook, you'll see that this works pretty much the same. You can select a recurrent schedule, maybe daily, maybe weekly, or maybe this is just a one-time appointment that we want to schedule. If it is weekly, you can say, okay, is it weekly on every Wednesday? And maybe we want to end after 10 sessions, so 10 weeks. You can do so here, and this will actually replicate itself on the actual calendar. So every Wednesday from 9 to 10, we will have this client's one-on-one meeting or session with our clinician. You can also choose no end. So this is showing for the entire whole entire year. These are going to be placed on the calendar, I'm assuming, until it's canceled. We will make sure to set that up for our group appointment. For our individual, I'll just say it's a one-time appointment. You have your evidence-based practices that you may need to select. And as far as our individual goes, this is all we need to complete for our appointment. You do also have quick buttons here that I want to point out. So you've got view client data, view financial eligibility, and view authorizations. This may be more on the clinician side, but those are options as well, and those will produce or populate reports with that information so that you don't have to go to the specific client to open financial eligibility or their demographics, etc. So I'm going to submit my form. And we will see that my Nellie Johnson ODF one-on-one appointment from 9 to 10 a.m. is going to drop on my clinician's calendar. It is an individual appointment, so we can see that that color is that yellow or orange. Now we are going to add in our group appointment. So does anybody remember what we have to do to bring up that appointment details screen and actually add in our appointment? What's my first step? Does anyone remember? What's the first step when I'm looking at my clinician's calendar? I want to actually add the appointment. When I add the appointment, a new window pops up for the appointment details. But what gets us to the point where our appointment details window will appear on our screen? You got it. Ding, 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 we have a winner. So we are going to right click, and that brings us to the option of add appointment. So this brings up our add new appointment window. This is also nice, in my personal opinion, that it's a new window. If you've got multiple screens, you can drag it to the other screen. You can make it smaller if you'd like. So just as a repeat from our individual appointment, we have our practitioner, our site, our date that is populating in, as well as our time. The date and time is populating in from where we right-clicked or selected on our actual calendar. At any point, this can be changed. So let's say it's actually the 4th that we want to add this appointment on. We can change that there. I will select my program again and my service code. This time I'm going to search my group service code. And what happens when we select our group code is that this system is going to help us out a little bit, and it's going to say, because this is a group code, we need you to enter in a group number. So it really helps you navigate through the actual adding the appointment, just so that you are making sure you have all of the information added that you need to. We also see that there is no really room for error because I cannot even select a client, and now my group number field is required. A note about the groups in the system that you may be scheduling. These are created by a form called group registration. So these are going to have group names and group IDs associated to them. So just as we have our service code and programs and client name, form name, you can search by the actual name of the group. So let's say recovery skills, or I see that 23 ID number there. I can search 23 as well. We then will scroll down, make sure that we add any co-practitioners that we need. This is going to be a staff overbooking alert. So this is just going to say, Megan Wirtz, who's my co-practitioner, has an appointment scheduled for the following date and time. I'm just going to say okay for now for time purposes to overbook. And maybe this is a weekly session for recovery skills. Every Thursday afternoon, and I'm going to want to end this after, let's say 12 sessions, so about 3 months. So once I tab out of my 12 sessions, it is going to list every appointment date and time. This is a good indicator to double check and say if we do have an end date in mind, was my 12 sessions enough? Maybe I've been told that this group is actually going to end in July, so I may need to extend that a little bit. The next thing that we will do for our group appointment is go down and select our group members section here. So as I did mention with the group registration form, this is where you actually name the group but also add in the group members. So any group member that is registered to that specific group is going to automatically appear in here. You may have certain scenarios where, let's say, Pablo calls and he says, I've just gotten into a car accident and I'm actually not able to attend the group today. Or maybe he just has a conflict and he knows earlier in the week. This is where you can go in and actually modify the group members for that appointment. So maybe Pablo is a regular group member. So the group registration form is going to state that he was starting this group on this date and ending here. But again, for the clinicians, so that they are making sure that they have the most accurate information, writing notes for the attendees, you can actually help the clinician out a little bit and remove any group members from this specific occurrence. So if I select remove, I can actually select Pablo's name and update my members. That way it's going to be a little bit more of an accurate depiction for my clinician when the group comes around and Pablo is not there. Additionally, if you are working with a new client that was recently admitted, maybe they aren't actually added or registered into the group, or maybe they are just attending a one-off session, you can add clients in here as well. So let me add my Cindy test. Actually, that is not the client I was using today, it was yesterday. Tommy test, so many test clients. I can choose for my specific episode. The client is going to be attending Thursdays, and I can update my members. That was an alert for co-practitioner. So if I update my members here, it's not going to let me, okay, 1 second, let me remove my co-practitioner really quick. I can go back and update my members. So now Tommy is also going to be attending this Thursday's session. If this client were to be attending each and every appointment from here on out, the client would need to be registered into the group. So this is not going to completely add or remove the client from the group. It's going to just basically be removing them temporarily. Okay, I'm going to submit my appointment. Okay, so we have our individual appointment on Wednesday, and then we can also see our appointment on Thursday for recovery skills. We can see it's a group appointment, so it's blue. The other item I want to point out is our symbol here on the right-hand side of the actual appointment. So this is one of the symbols that we have in the system setup. It looks like kind of a purple wraparound arrow. This is a symbol that signifies that it is a recurring appointment. So I can quickly look at Thursday, even though I can only see this Thursday, I can see that, okay, this is a recurring appointment. If I look on the 10th, I can see my recurring appointments again. A few other recurring symbols, or not recurring, symbols that will appear on the appointments. Some that will be helpful on your end, some more helpful on the clinician's end for kind of management of their calendar. We've got the appointment was checked in, so this is going to show us like a green check mark. Maybe the appointment was canceled. This will show us like a red X. We have progress note is final, so a progress note has been written against this specific appointment. And a couple other symbols that are going to be in your guide to view, kind of to help you out and manage the different calendars. The last appointment that I do want to set up and show you guys is going to be our indirect staff activities appointment. So I am going to change sites in order to get this specific service code to work. Once again, I am going to right-click on the relative time and the date in which I want to schedule the appointment. We have our program. The service code I'm going to use for this example is going to be 405, and this is going to be for training received. So the indirect codes or staff activities, they really are there to show any of those activities that are not provided to clients with an open episode, or maybe services provided to community members, or other staff activities such as trainings, blocked off time, for example. So similar to the individual service code being stated as individual, and we need to complete our client field, and our group code stating and requiring our group number field. Our service code is going to, if it's an indirect code, it's not going to require or enable either of those. So this is really stating that, okay, this is all the information we need. You don't need to enter in a group number, client, and that this is going to satisfy our requirements. You can also make these recurring, so maybe for the month of January, you've got a training every morning from 8 to 9, or maybe a team meeting that you guys have at your different programs or clinics. You also have that recurrence feature there for these appointments as well. I'm going to submit my form and see that our appointment is now on the calendar and it's going to be in green. Just a tidbit of information, may not be as relevant for you all, but I want to go over this. If you right-click on the actual appointment, the clinicians will be able to launch the progress notes right from that appointment. So I keep mentioning that you can pull in directly the service information. So this is just kind of an extra shortcut for them that I always like to highlight, and it will pull in directly that service program and start time, end time, practitioner name, all of that information that they will not have to worry about duplicating again, maybe with incorrect details. They can make sure that every appointment and every service that they are providing, that they are billing for that and writing their notes against. You also will see different actions by right-clicking as well. So you've got check-in, check-out options. If you do need to edit any of the details in the appointment, you can select details or edit. So this is where the clinician would be able to go in order to maybe view those group members or any appointment notes. Maybe they want to view the evidence-based practices. Maybe you needed to come in here and this is going to be shortened to a 30-minute appointment. You can come say that it's going to be 30 minutes and resubmit your form. And it's now going to be modified that way. You can also copy appointments as well if you want to paste onto another clinician's schedule. You have a status update here, so instead of changing the actual status on the details, you'll select status update, and maybe this is a canceled appointment or the appointment's a no-show. You can change those. This is one of the symbols that I was referencing earlier, so maybe the client was a no-show. When I change that status, we now have our disposition symbol here. Deleting appointments, overbook, a few other options. You can also click and drag as a way to move times or dates for the actual appointment. So I can kind of click and drag my mouse. So now this training is going to be Thursday at 1:40. If I look at my edit or my options here to edit, my date has been updated here. So as we've been showing elsewhere in our training today, just a couple different options for doing things. So just play around in the UAT environment and really determine what is the most comfortable for you. Just a few other options or functionality I want to show you before we get into our exercise that I think will be very helpful for you guys on a daily basis. We have these two hyperlink options over here to our left-hand side, maybe a little bit small on your screen. This first one is going to be Find New Appointment. So this is going to be a very easy way if you are an office assistant or someone that is managing the calendar for all of the practitioners at your site. Instead of having to go and look through 15 different calendars for this specific week to find the next available appointment, your client is trying to schedule that. This will allow you to enter in different search criteria in order to find open slots, in order to actually find what is available to book another appointment for. So this really can be as detailed or as open of a search as you choose. You can see really the only required field for this search is going to be our search start date. But if your client is only receiving services or only can get to the Rialto clinic, or let's do our Mariposa. You can select that I want to find the open time slots available, but only for Mariposa. I can do search start date. Let's do the beginning of next week. I can do a search end date. So let's say they do need to get in within the next couple weeks. So I could do next Monday through the 22nd. You have certain practitioners, so maybe this client needs to find the nearest time of availability with me. If that is not something that is important, maybe that there is a couple different clinicians that this client could see, you can leave that blank. Let's say our client is only available on Tuesdays, Thursdays, and Saturdays. You can search to where you only have those options or those available time slots on those certain days. So a lot of cool functionality here that really can fit a lot of different scenarios. We do have maximum number of search results to display, so this does automatically go to 10. So in your real life examples, this may be large enough, but what I like to note is that that does just automatically generate as 10, but you can search above. Obviously, in a 2-week time frame, when you've got clinicians that are fairly booked up, you may not have even more than 10 results, but for testing purposes, definitely want to up that, and then I can select Find Availability. And this will show the appointment dates that are available, the day of the week, And each time slot, I did state that I wanted to make sure this was appointment or that we are viewing the availability for Megan. So the practitioner is going to just be Megan. If you had stated no practitioner, you'd be able to see each and every one of those practitioners, their eligibility, the sites. So you can quickly go and say, okay, looks like Megan's got availability on Monday the 8th from 12 to 1. And maybe you can communicate with the client and say, does this work? Maybe he's like, oh, actually that doesn't work. What's the next available one? Okay, looks like she also has a 3 to 4 on that day. So you can quickly pull this information up. You saw how quick that generated for me. So even if you are on the phone with a client, you can do this pretty easily. This would take quite a bit of time if you had to pull up literally every one of your clinicians' schedules and just kind of go and see, okay, oh, looks like they've got that 30-minute time slot. Is that 10:30 to 11? So this is a super nice report that's always helpful to practice with kind of navigating and seeing what you can, different scenarios in which you can produce those results. We also may have scenarios where you may not know, the client may not know the upcoming appointments, or maybe they call on a Monday and they say, okay, I know I have an appointment this week, but I don't know if it's Thursday or if it was Friday or who the practitioner is with. So you also have an option to find existing appointments as well. So if it is a specific client, like I gave in my example, I could search. Let's see, what was the client? Let me look who I used earlier in our example. So we've got 11:59. Let's say Nellie knows that she has been with seeing Megan, so that's a good way to narrow that search result down. We'll just say, starting with today, Nellie wants to know what her future appointments are. We can see that Nellie has one that was today. Obviously, if this was a more real-life example, we would see those that were scheduled in the future as well. But if our client had a recurring appointments, you could see that here, or you could just see, okay, Nellie, you actually have an appointment that is going to be on the 9th, as well as you have an appointment on the 11th from 10 to 11. So good information here to narrow that down as well. Another button or action we have over here to our bottom left is going to be our refresh button. So as we saw with adding the appointments, that it does reflect on the calendar pretty fast, but you may be looking at different calendars, and as others may be adding in different appointments, it may not update that fast. So you may want to get in the habit of selecting refresh just to verify that when you are looking at a clinician's calendar that it is the most up-to-date, and that Sally over here to your left, who is also scheduling appointments, didn't just schedule one 30 seconds ago. We do have a few additional reports here. You can print client appointment reminders. So as we were just looking in the system, so Nellie is calling and seeing what her future appointments are, you can enter the client's name and select print appointment reminder to actually produce a handout of her future appointments. You can also display canceled appointments on a quick schedule. The print practitioner's quick schedule is going to show each of the appointments for the practitioners for that day. You can also look at the different sites and print that information as well. There is a lot of information on this print reports, so I encourage you to make some selections and see what those reports produce. Some of them can take a bit longer, so I tried to run one yesterday in our training session, and it didn't populate for a while. So I will try to get one of those running as you are doing your exercise, but just know that this is what our reports section does. It will have a few different reports that you can do. And that is really the gist of our scheduling calendar.